Hello, and welcome to the University System of Georgia New Hire Benefits Enrollment Orientation. Thank you for joining. My name is Catherine Bullock, and I am from Aon, a USG vendor, and I will be presenting your New Hire Benefits Orientation today. Before we get started, let's review a few housekeeping items. All mics have been muted and cameras turned off to provide a seamless orientation. However, if you have a question, please feel free to use the question and answer feature, and a team member behind the scenes will answer as promptly as possible. Now, questions should be general in nature. More detailed or personal type questions will need to be answered by your campus HR benefits team, or we will follow up with you after the session maybe. If you miss any part of today's presentation, an on-demand version will be available on the USG Benefits website in the New to USG section, the same place where you registered for this session. Again, welcome and thanks for joining. Welcome to the University System of Georgia family. USG is comprised of 26 higher education institutions, including 4 research universities, 4 comprehensive universities, 9 state universities, and 9 state colleges, as well as the Georgia Public Library Service and the Georgia Film Academy. Your benefits are provided through the University System of Georgia. We know that USG benefits are important to you and your family. They offer protection, peace of mind, and comfort, and we want you to make the most of them. Today, we will talk about all the benefits offered through USG. However, there may be additional benefits available to you through your institution that coordinate with USG benefits. Please be sure to contact your campus office about those offerings if available. The USG benefits package is very comprehensive, which means we will be sharing a lot of information today, and there is a lot to learn. Just know that you don't have to do it alone, though. You always have the option of talking with your HR benefits team at your institution or the One USG Connect Benefits Call Center to review your choices, assist you with the enrollment process, and answer any questions that you have about your benefits. You'll hear more about this later. Now here is what we're going to cover today. First, a quick overview of some resources to help you get started. Next, we'll go over who is eligible and when to enroll, and then dive right into learning about the healthcare benefits, such as healthcare, dental, vision, spending and savings accounts, life and disability, to name a few. Next, we'll touch on the USG Wellbeing Program, and then we'll cover retirement benefits, both mandatory and supplemental, because you have choices. And last, we will talk about how to enroll, provide some final reminders, and then open up and maybe answer some of your questions. So let's get started. USG benefits are centered on you. We provide a robust benefits package that includes healthcare, supplemental, financial, retirement plans, as well as well-being and work-life programs. These are benefits that will support you at any point of your life while at USG. We'll walk through these benefits today to help you consider your options so that you can make the best choices when you enroll. I'd like to point out a few common resources that you'll find most helpful during your new hire and benefit enrollment journey that I'll be referring to today as I go through this presentation. One USG Connect is a database where employees can log in to view personal information. One USG Connect Benefits is our benefits portal where you'll make your benefits enrollment elections. If you prefer calling into the call center for enrollment, that's an option as well. The USG Benefits website is where you'll find centralized USG benefits information, including plan documents. And last but certainly not least, your campus Human Resource Benefits Office will always be able to support you by answering questions about your benefits or the process to enroll or any other new employee inquiries. For access to the resources mentioned on the previous slide, you can visit the Faculty and Staff portal at oneusgconnect.usg.edu. And you'll want to bookmark this website. This site is used by all USG institution employees to access benefits, paychecks, personal information, and the timekeeping system. Once on the site, you'll notice the blue action buttons for active employees on the top right side of the page. The One USG Connect button will allow you to access to verify your personal information, record and submit time off, provide your direct deposit information before your first payday, and view pay stubs. The Manage My Benefits button will allow you to access One USG Connect benefits, the benefits enrollment portal, where you will enroll in benefits as a new hire. You'll also complete your open enrollment during that time of the year, initiate qualified life event changes, update your beneficiaries, and complete your retirement plan enrollment. This is where you will also access decision support tools to help you choose which healthcare plan is right for you and your family. Remember, One USG Connect Benefits has both online access and call center for your enrollment needs. When gathering information about your benefits, you'll want to get to know the USG Benefits website. This is your benefit resource library with all the information about your benefits and then some. Start with the New to USG tile. In this section of the website, you'll find everything to support you learning more about your eligibility to enroll, who's eligible to be enrolled, and how and where to enroll in healthcare benefits and your retirement plan. This is also where you'll find the USG Comparison Guide, which is a booklet that contains all the plan details, premiums, and contact information. And I will refer to this often today, as the information I'll be covering will be high level, and for more information, you'll either need to go to the website or use the comparison guide. So now that you're familiar with where to find benefit resources and where to start, let's move on to who's eligible and when to enroll. As a new employee or newly benefits eligible employee, this is a snapshot of the benefits and/or programs available to you based on your eligibility. As a faculty or staff member working 30 or more hours per week, you are fully benefits eligible for healthcare plans, retirement, and all the additional programs offered. If you're faculty or staff working 20 to 29 hours per week, you are partially benefits eligible and able to enroll in USG mandatory and supplemental retirement plans and access to other optional benefits and programs. And for employees working less than 20 hours per week, you are eligible for well-being participation and other programs. What about who you can cover under your USG benefits? Dependent coverage is offered for many benefits, such as healthcare, dental, vision, and life insurance plans. The eligible list of dependents include your legal spouse, your natural, adopted, or stepchildren up to age 26, your disabled children over the age of 26 with proof of disability before age 26. Now, there are a few requirements for adding dependents to your coverage. You must provide a Social Security number and proof of relationship documentation for each dependent, with the exception of newborns. Now, common examples of documentations include a birth certificate, guardianship documentation, marriage certificate, income tax return, and or maybe a joint utility bill within the 60 days of the enrollment. For a complete list of required documents, visit the USG Benefits website. One final note on dependents. If you and your spouse work for the University System of Georgia, you cannot be covered as an employee and a dependent. Additionally, your dependent children may only be covered under one plan. Please keep that in mind when you're enrolling. Now let's discuss the timing of enrollment for the healthcare and voluntary plans. For these plans, you have 30 days to enroll from your date of hire or the date you became eligible. Please make sure you act promptly to avoid missing your enrollment window. Remember, if you don't enroll by the deadline, you will not be allowed to enroll until the next open enrollment period, which is usually in the fall, or unless you have a qualifying life event, such as the birth of a child, marriage or divorce, loss or gain of other coverage. If you have previous insurance coverage from a previous employer, this might be a valid reason to delay your new hire enrollment. In that case, you can enroll in USG coverage within 30 days of that coverage ending to avoid double coverage while at USG. And you can initiate that process through one USG Connect benefits site or by calling the call center. Now, there is an exception here. You will not want to delay your life and disability enrollment because during your new hire eligibility period, the evidence of insurability process or EOI process is waived. But if you enroll at a later date, you will be required to provide evidence of insurability. To recap this message, you have 30 days to enroll from your date of hire or the date you became eligible. Now, in addition to the healthcare and voluntary enrollment deadline, there's a separate one for your USG mandatory retirement elections. For non-exempt employees, those that are hourly paid, you are automatically enrolled in the Teachers Retirement System of Georgia plan, commonly referred to as TRS, so no action is required on your behalf. For exempt employees who are salaried and monthly paid, you must enroll within 60 days of your date of hire or the date you became eligible. You have two plans to choose from, the TRS plan and the optional retirement plan, referred to as the ORP plan. A very important note is that at USG, once your election is made, you cannot change it, even if it's within that 60-day election period. Now, supplemental retirement plans are also available, and we're going to talk about those more later in the presentation. A popular question for new hires is, when do my benefits begin? Well, first, your healthcare benefits. Your benefits will become effective the first day of the month following your date of hire or the date you became eligible, unless your date of hire or benefits eligibility date is on the first of the month. Then your coverage begins on your date of hire, which is the first. That was a lot, right? So here's two examples. If your date of hire is March the 2nd, your coverage will begin effective April the 1st. If your hire date is March the 1st, though, coverage would begin immediately on March the 1st. Now, if you elect any of the plans I'm going to name, your coverage will be effective the first of the month following the date you make your elections. So for flexible spending account, health savings account, accident plan, critical illness, hospital indemnity, those are again effective the first of the month following the date you make the election. And one way to keep up with your effective date of benefits is when you're in the One USG Connect benefits, the system will show you your effective date of coverage for each plan that you elect. You'll also receive and see it on your enrollment confirmation statement. Now that you know that USG retirement is a mandatory enrollment, let's talk about when your retirement benefits begin. For non-exempt, the hourly paid employees, you are automatically enrolled in the TRS plan and your contributions are effective on your date of hire or the date you became eligible. Remember, no action is required. For exempt, salaried monthly paid employees, if you enroll in the TRS plan, your contributions are effective as of your date of hire. Even if you take the full 60 days to make your decision, your enrollment and paycheck deductions will be retroactive to your date of hire or the date you became eligible, which means additional funds will be deducted from future paychecks. So don't forget that. Now, if you enroll in the ORP plan, your contributions are effective the first of the month following your election. And remember, once you make your election, you cannot change it. To wrap up the first part of the agenda, here's a quick look at who pays what and how your benefits are taxed. And as you will see, USG shares the cost of your health care, health savings account, and retirement benefits. And then notice, USG provides tuition assistance and an employee assistance program at no cost to qualified employees. Now let's pause here to see if we have any questions from the audience. I've got a team behind me. Is there anything out there that we want to address right now?
There are no questions.
Awesome. Thanks so much. And thanks everybody for paying attention. So that wraps up the resources, eligibility, where and how to enroll, and deadlines. Next up, healthcare and pharmacy benefits. USG offers 4 healthcare plans, and here is a snapshot and brief description of our plans. First, we have the Anthem Consumer Choice HSA plan. This plan has the lowest premium of our 4 plans, which comes along with the highest deductible. It includes coinsurance, and designating a primary care physician is not required under this plan. In and out of network coverage is available. Healthcare and pharmacy costs collectively count towards your out-of-pocket maximum and deductible. And last, this plan allows you to make contributions to a health savings account, or HSA, which has an employer match to help pay for your out-of-pocket expenses. We'll talk about this more later. Next, the Anthem Comprehensive Care Plan. This plan has a standard deductible. It includes a combination of coinsurance and copays. Designating a primary care physician is not required for this plan either. And it also includes in and out of network coverage for you. Now here's another Anthem plan, the Blue Choice HMO plan. This plan doesn't have a deductible. It has a copay structure where the costs are maybe more predictable. Naming a primary care physician is required, and this plan has in-network coverage only, which is limited to the state of Georgia. Only emergency care is available if you're traveling out of state and need care. And last but not least is the Kaiser HMO plan. Again, this plan doesn't have deductibles. It's more predictable costs with copays. You are required to name a primary care physician. It is limited to Kaiser facilities, and it has in-network coverage only, which is limited to the state of Georgia. Only emergency care is available if you're traveling out of state and need care. This is a very high-level overlook of how the plans compare. Next, let's take a look at the HMO networks. The Blue Choice HMO and Kaiser HMO are only available to employees who live in certain areas. And this is a simplified snapshot of service areas by counties, which is also listed in your comparison guide for reference. Next, we'll take a quick peek at healthcare plan premiums. You're probably skimming the page to find the monthly premium that would probably be the best choice for you and your family. But please note that USG shares in the cost of your monthly premium. You can take a look in the comparison guide for the details. Now here's what you can expect in regards to how you're billed for your healthcare premiums. If you're paid monthly, the premium will be deducted from your paycheck at the end of the month for that month. If you're paid biweekly, you'll have 2 deductions that will total the monthly premium that you see on this slide. For our academic year or 10 monthly faculty, you will pay the normal monthly premium from August to December. However, from January to May, you will pay 7 months of premiums over that 5-month period. This is known as 7/5, which is for coverage over the 2 summer months. If you have additional questions about 7/5, you can contact your campus HR or benefits office. Now, although we provided a high-level overview of your healthcare options, when enrolling in One USG Connect benefits portal, there's a healthcare expense estimator tool, which may help you. This tool will help you better understand which plan is the best for you and your family. You can enter various scenarios, either based off of your previous healthcare experiences by using your explanation of benefits or EOBs, or you can enter hypothetical situations to see what plan works. The tool will use national average of healthcare coverage usage based on how you define your overall health. This wraps up our healthcare plan design overview. Check out the comparison guide with charts and more information to consider. And don't forget, enter your questions in the Q&A, and I've got a team behind me that will answer them um, directly to you. They're private questions. And if we have time, we'll address some of them later in the presentation. Moving on to a very important action step if you enroll in USG Healthcare Plan, completing your certifications. There are two required certifications you need to make in order to avoid paying if they don't apply to you. There's the tobacco surcharge, the tobacco surcharge and the working spouse surcharge. When you enroll, you will certify your status as a tobacco user or a non-user, as well as the status of your spouse and any dependents age 18 or older that are enrolled in your USG healthcare plan. Tobacco user refers to the use of tobacco products within the past 3 consecutive months. Tobacco products refers to any tobacco product, including cigarettes, cigars, pipes, and all forms of smokeless tobacco, clove cigarettes, and any other devices that use or simulate the use of tobacco, such as hookahs or electronic cigarettes. Tobacco users will be charged $150 per person for employee and spouse, and then one surcharge for all children, dependents age 18 and older. If you're a tobacco user and you'd like to quit, USG offers no-cost tobacco cessation programs. Visit the USG Benefits website for more information. Let's switch gears to the working spouse surcharge. If you elect to enroll a spouse in a USG healthcare plan, there is a surcharge of $150 per month that will be applied if your spouse works for an employer other than USG and is offered healthcare coverage from that employer. Complete the working spouse surcharge certification when you enroll. Otherwise, this surcharge will apply if your spouse is enrolled in coverage. Now, if either of these statuses should change during the year, please call the One USG Connect Benefits Call Center promptly to change your status. Let's shift to pharmacy benefits. For our 3 Anthem plans, your pharmacy coverage is administered through CVS Caremark. And there are many in-network pharmacies, among them Kroger, Walgreens, Walmart, Publix, CVS, and more. What you pay for your medications depends on the plan that you enroll in, the type of medication that you take, and the quantity of the medication that you take. For our Kaiser plan, your pharmacy coverage is administered through Kaiser, where their pharmacies are located within each facility. You can log into your Kaiser account once you've enrolled for an approved formulary list and cost. There are many resources for your pharmacy benefits that are included with your Anthem CVS Caremark plans. Preventive drug list, a standard drug list, specialty drug list. And for Anthem members, Accolade can assist you to understand the drug list, coverage, and cost associated with pharmacy benefits, in addition to other healthcare concerns. And we'll discuss that next. Employees who are enrolled in one of the Anthem plans have another included benefit to their healthcare plan, Accolade, at no additional cost to you. If you reach out to them, you will be assigned a personal health assistant. This person serves as your advocate, champion, and first point of contact for all of your healthcare and pharmacy questions. Now, how could your Accolade health assistant help throughout the year? Well, understanding a new diagnosis or treatment options, ongoing conditions, maybe finding in-network doctors for you, doing the legwork to help with coordination of care, following up with your doctor for prior authorization paperwork, answering questions about billing and explanation of benefits, explaining what is covered with preventive services, like what screenings you should get, and even helping schedule appointments. And they help by connecting employees with other USG resources that might be available. So be sure to connect with Accolade by visiting their member website, calling, or via their mobile app. Let's move on to spending and savings accounts. A flexible spending account, FSA, allows you to save money on a pre-tax basis for healthcare, dental, vision, and other dependent care and or dependent care expenses. And that means it reduces the amount of income that you pay taxes on. USG offers three types of flexible spending accounts through HSA Bank. There's a healthcare FSA, a limited purpose FSA, and a dependent care FSA. We'll start with the healthcare FSA. This account allows you to set aside money to be reimbursed for out-of-pocket expenses such as medical deductibles, copays, prescriptions, dental, and vision care for you and your family. Enrollment in a healthcare plan is not required to participate in an FSA. The limited purpose FSA. This is another tax-free account that pairs well with the Consumer Choice HSA healthcare plan and health savings account. However, unlike the healthcare FSA, this FSA is only for eligible out-of-pocket vision and dental expenses. Now, these two FSA accounts are front-loaded accounts, which gives you immediate access to your annual elected amount after your first paycheck deduction. Excuse me. The last type of FSA available is the dependent care FSA. This account is for daycare expenses only, not to be confused with the healthcare expenses for dependents. You can put pre-tax contributions into this account for your legal dependents up to age 13 for any dependent care program that allows you to work. Common examples are daycare, after-school care, summer, and specialty camps. Now, please be mindful if your dependent will reach the age maximum during the time period that you're enrolling in this plan. You can also use a dependent care FSA for elder care if you are the caregiver for an elderly dependent whom you claim as a dependent on your taxes. And the funding for the dependent care FSA is different from the other FSAs in that it is funded by your per paycheck deduction, not front-loaded. A few FSA reminders. You decide how much to contribute to your FSAs in an annual amount based on the number of months left in the current year. Money is then deducted pre-tax from your paycheck in equal installments. Use your HSA Bank Health Benefits debit card to pay for qualified healthcare expenses for you, your spouse, and your dependents. Or for dependent care, you pay out of pocket for eligible expenses and submit a claim for reimbursement. This is a use it or lose it benefit. That's important. Plan your expenses carefully. Your contributions do not roll over from year to year. And for a comprehensive list of eligible FSA expenses, visit www.irs.gov. It's all there for you. And each year you must re-elect your FSA during open enrollment. As a new hire, remember, if you've made prior contributions through another employer, ensure that your combined contributions don't exceed the annual limit and subject you to any IRS penalties. One last pre-taxed account is our health savings account, otherwise known as an HSA, also administered by HSA Bank. Now, we've mentioned it before, but here are the details. If you enroll in the Consumer Choice HSA healthcare plan, You are eligible for a health savings account, which allows you to set aside pre-tax dollars for eligible out-of-pocket health care, dental, and vision expenses for you and your dependents. It's different from flexible spending accounts. Your contributions roll over from year to year. And once you have a balance of $1,000 or more, you may invest your HSA balance through Devenir or a TD Ameritrade account. And you can adjust your pre-tax contributions throughout the year if you experience unexpected expenses. The 2023 annual contribution limits for single is $3,850 and for family is $7,750. There are no monthly maintenance fees, and the best benefit of having this account is that USG will match your contribution dollar for dollar up to $375 for single coverage and $750 for family coverage. This account can definitely help you with paying for healthcare visits before meeting your deductible. That was a lot of information about healthcare, pharmacy, spending, and savings accounts. I hope you got the information you needed to help prepare you for your enrollment. Remember to post your questions in the Q&A if you need an answer on something in particular. But let me pause here to see if there's any questions in the Q&A for us now. Is anything out there, Penedra?
Yes, Catherine, we have two questions.
Awesome.
The first is, I'm a remote employee living and working in Texas. What is the Anthem equivalent for Anthem Blue Cross Blue Shield, Blue Choice HMO? Since I don't live or work in Georgia, I cannot use Anthem as no doctors, as there are no doctors in the state of Texas that work with the network. Actually, so that's a great question. So this is backtracking back to our medical plans. Since this person is working remote and not living in the state of Georgia, Blue Choice HMO plan is not an option, would not be a viable option for them because the Blue Choice HMO plan is an in-state of Georgia plan only, meaning that the network physicians are only in the state of Georgia. Any coverage outside the state of Georgia would be emergency type situations that would be covered if deemed as an emergency. So great question there. But the two other options that person has to choose from are the Blue Choice, the Anthem Consumer Choice HSA plan and the Comprehensive Care Plan. Both of those plans have in-state and out-of-state coverage, meaning that physicians in-state as well as out-of-state do accept that coverage. So those are options for that employee. And then we have one other question. When will the FSA be a premium that comes out in addition to the health, dental, and vision premium? And so, yes, that's a great question as well. The annual amount that you elect for to contribute to an FSA flexible spending account, that will be deducted on a monthly basis in addition to all other benefit premiums. So it's whatever amount that you elect on an annual basis. If it's $2,000 for that annual election, then it will be divided based on the number of pay periods you have left in that calendar year, as far as the deduction. So it could be monthly if you're monthly paid, or it could be biweekly if you're biweekly paid. So that is a great question. And looks like I have one more. So can you only get the HSA if you choose the choice plan? And so that is correct. The only way that you are eligible to contribute to a health savings account is if you're enrolled in the Anthem Consumer Choice HSA healthcare plan. So you have to be enrolled in that Anthem Consumer Choice HSA healthcare plan in order to contribute to the HSA. And remember that HSA is quite attractive because it does give you employer contribution, employer dollar for dollar match, as opposed to the flexible spending account. So great question there. And I will answer that question in chat. So they'll have that answer as well, but it just came up and wanted to share with the group. Thank you.
Thank you so much, Benedra. Now let's move on to the USG dental and vision plans. We offer two dental plan options through Delta Dental, the Delta Dental Base Plan and the Delta Dental High Plan. Under these plans, you have access to 3 levels of care: in-network, Delta Dental PPO, and Premier networks, and there is out-of-network coverage as well. Keep in mind that you will pay less if you use an in-network dentist. Two key differences in the plans. First, the maximum annual benefit is the most the plans will pay for eligible services each year. The base plan has a $1,000 maximum annual benefit per covered person, and the high plan has a $1,500 maximum annual benefit, so a little more benefit there. This maximum does not include diagnostic preventive services because they are covered at 100%, no cost to you. Second, the high plan includes orthodontia benefits with a separate lifetime maximum. Now here's an example of how the networks may work. The price of a filling may cost $200 if you're using a PPO dentist, or maybe $275 if you're using a Premier dentist, and $550 if your dentist is out of network. And you will pay 20%, the plan will pay 80%. The cost savings is greater if you use the PPO or a Premier dentist who is in network. And please note, the extraction of wisdom teeth are covered under dental, not USG healthcare plans. ID cards are not issued for this plan. You simply tell the dentist the name of your plan and they'll be able to access your benefits on your first visit or for your visit. Moving on to our iMed Vision Care Plan, which can save you money on routine eye exams and eye care materials. In network, the plan has copays for certain services and allowances for frames and/or contact lenses. Out of network, benefits are the maximum amount you would be reimbursed. It's another reason to use in network, right? And in addition to the Insight network, you have access to iMed's Plus Provider Network, where you will have a $0 copay eye exam and receive an additional $50 frame allowance. Now, please note, all USG healthcare plans allow for one healthy eye exam per year at no cost to you. We are over halfway to the finish line of this orientation. Thank you so much for hanging in there. I know it's a lot. Let's transition to the life insurance and disability section. We provide a $25,000 basic life insurance through MetLife at no cost to you. That includes a matching amount of accidental death and dismemberment coverage, AD&D. You can purchase supplemental life insurance coverage for you, your eligible spouse, and children. Employee and spouse supplemental life rates are age-banded and can be found in the One USG Connect benefits when you enroll. The limits on this slide apply for you as a new hire or newly eligible employee. So for employee supplemental life, you'll choose between 1 to 8 times your annual salary and benefit. Now you can elect coverage up to 3 times your annual salary, not to exceed $500,000 without evidence of insurability or EOI. For spouse life, choose $10,000 increments up to $500,000 coverage. You can elect up to $50,000 for your spouse without EOI. In child life, you'll choose between $5,000, $10,000, or $15,000 limit, no EOI required. For voluntary AD&D, employee coverage, $10,000 increments up to $500,000 coverage. And for a family plan election, it will be a percentage of your elected amount. Conversion and portability options are available for all plans, and that means you can take these plans with you if you separate employment from USG. Note, if you do not elect supplemental employee life or spouse life when you're first eligible, you will be required to provide evidence of insurability in the future for any amount that you want. And remember, if you and your spouse are employed by USG, you cannot be covered as an employee and a dependent. And your dependent children cannot be covered by both parents. That's important. And last, don't forget to assign beneficiaries for your life insurance enrollments. This is a very important to do, even if you only have the basic life insurance that we provide. Disability insurance is a great way to protect your income in the event you are disabled and unable to work. Short-term disability provides a benefit of 60% of your weekly earnings to a maximum of $2,500 per week. Benefits would begin on the 15th day of a qualifying disability and continue for a maximum of 11 weeks. Now, you may use your available vacation or sick leave during the elimination period, which is the time before your disability plan payments begin. Short-term disability insurance may be important to provide income to you while you are out of work, and now is the time to enroll. Waiting to enroll after your new hire eligibility period will require evidence of insurability. Long-term disability. If you are still disabled after the 11 weeks of short-term disability ends and you are enrolled in a long-term disability, then long-term disability will begin for a covered disability. The benefit will replace up to 60% of your monthly earnings, up to $15,000 per month. Your benefits will continue as long as you meet the definition of disabled under the policy or you reach age 70. There is no evidence of insurability required because there is a pre-existing condition limitation clause in the policy. Let's take a look at our voluntary plans, accident, critical illness, and hospital indemnity insurance. Now, all the rates and additional plan information can be found on the USG Benefits website. The accident insurance through AFLAC will cover you if you or a covered dependent experience specific injuries and events resulting from a covered accident. Now, accident insurance is not health insurance, but it can help offset out-of-pocket costs that your USG healthcare plan does not cover. The benefit amount depends on the type of injury and care received. Some examples: fractures, dislocations, burns, physical therapy, ambulance, and more, which you can see in our comparison guide. You'll have 24/7 coverage for accidents. There's a sports benefit, which pays an increased benefit if the accident is a result of an organized sports injury. And there is a separate $50 annual wellness screening benefit, one time per year per covered individual when you or a covered dependent have certain exams like blood tests or screenings. The critical illness plan provides a lump sum payment directly to you in the event you are diagnosed with a covered condition. Critical illness insurance is not health insurance either, but it can help offset out-of-pocket costs that your USG healthcare plan does not cover. Coverage is provided through AFLAC and has guaranteed acceptance. This coverage also has a $50 annual wellness screening benefit. And you may elect $10,000, $20,000, or $30,000 for your coverage. Your spouse is eligible to be covered for up to half the amount of the coverage that you elect. You must elect the coverage for your spouse if you want to enroll them, though. Children, though, are automatically covered at 50% of your benefit amount at no additional cost. Hospital indemnity insurance through AFLAC provides cash benefits if you are admitted to a hospital due to a covered accident or sickness, including maternity. Coverage is available for employee, spouse, and children, and there is no benefit reduction, which means payments are not offset or reduced by other planned payments. Benefits are paid regardless of whether you have other insurance coverage. The benefits can be used however you choose for out-of-pocket expenses like deductibles and coinsurance, or to cover non-medical expenses such as household bills and childcare. And the benefit is portable if you retire or change jobs. Benefits include a hospital admission benefit, hospital and confinement benefit, including for maternity, just to name a few. USG also offers additional benefits and the opportunity to participate in them and complement your existing coverage to help protect you and your family in various ways. A legal plan through legalese for legal services like wills, document preparation, and more. MetLife Pet Insurance, coverage for your furry family members. Path to College, 529 College Savings Plan. The cost of higher education is going up, but saving for college doesn't need to be a burden. There's no big upfront investment, and you can start saving quickly and easily. USG Perks at Work is designed to help you find discounts and programs that matter to you, including savings on your favorite brands. Allstate Identity Protection delivers the next generation of identity protection, a proactive monitoring service that alerts you at the first sign of fraud. And that is just the beginning of what is included in this benefit. And then purchasing power, where you have access to emergency needed type products and more. One additional benefit that's popular is our tuition assistance program. As a part of USG's desire to meet its employees' evolving needs, we have established an educational assistance program to foster the professional growth and development of our eligible employees. After 6 months of employment as a full-time benefits eligible employee, you can use this benefit to attend any USG institution for up to 9 academic semester hours per semester. You can obtain your associate, bachelor's, master's, doctorate degree, or even attend an academic certificate program by using this benefit. With certain exceptions for concentrations in dental, law, medical, pharmacy, veterinary, or the executive total cost programs. A waiver will be applied to the tuition and mandatory fees upfront. Excuse me. Please check the USG TAP website for additional important details, such as the application, deadlines, exclusions, FAQs, and a list of TAP coordinators at each institution that can help you with your questions. Next up, USG Well-Being. The USG Wellbeing Program is a no-cost, confidential, and voluntary program aimed at encouraging and supporting all aspects of employees' well-being in areas such as health, finance, nutrition, mental health, social involvement, and more. USG employees and spouses who are enrolled in a USG healthcare plan can earn up to $200 in well-being credits annually, with over 50 ways to earn by completing healthy activities. The earning window started in October of 2022 and it goes until September 30th, 2023, and the payout is in November of 2023. Here's a little snapshot of the list of activities. There's a complete list of earning opportunities when you log into your well-being account. For example, taking a health assessment survey earns 5,000 points. Receive a flu shot or a COVID shot for up to 1,000 points. And 40,000 points equals $200. Are you ready to get started? You can do so by registering your account on either our Wellbeing website or download the Virgin Pulse mobile app or through One USG Connect benefits. We can't wait for you to get started. Some additional well-being programs that are available to all employees: Money Mondays, Wellbeing Wednesdays, biometric screenings, and flu shot clinics. And then Anthem members have access to Livongo, which is a condition management and prevention program to support a healthy lifestyle. Programs available to Kaiser members: Omada, which is similar to Livongo, and Weight Watchers for general weight management. Additionally, Kaiser offers additional mental health programs like Ginger and Calm. You can learn about the Anthem and Kaiser programs after you select your health plan. Make sure you check out these programs that are available to you. Our Employee Assistance Program, or EAP, through KeyPro offers a wide range of services to you, such as confidential counseling for employees and family members, 4 free sessions per concern. There's adoption assistance, maybe assistance finding child and elder care services, daily living and concierge services, travel, cleaning, moving, etc. They're available 24/7, 365 days a year for consultation or information assistance. And that just spotlights a few of these services. Visit the My Life Expert website to learn more and get expert assistance. Now let's change the pace to cover the USG retirement plans. What are the USG retirement plan options? Well, as a USG employee, you are required to participate in a retirement plan. USG offers 2 mandatory options for some eligible employees. the Teachers Retirement System of Georgia, TRS. If you are a non-exempt or hourly paid employee working 20 or more hours per week, you are automatically enrolled in the TRS plan. Now, if you are a vested ERS, which is the Employee Retirement System of Georgia member, you can continue to participate. Reach out to your campus HR benefits office for enrollment in that plan only. The Optional Retirement Plan, or ORP. If you are an exempt or salaried employee, you have a choice between TRS and the ORP. Your election must be made within 60 days of eligibility, or you will be defaulted into the TRS plan retroactively to your date of hire or eligibility. Once you make your retirement election, your decision is irrevocable. You will not be able to change it. For exempt employees who have a choice between the TRS and the ORP, here is a look at the highlights of both options. The TRS plan is a defined benefit plan or pension plan, and this means it's guaranteed based on a formula, not on investment returns. So the amount is locked in and guaranteed once vested after 10 years of creditable service. Whereas the ORP is a defined contribution plan. Your benefit is the balance you've accrued through contributions and returns when you retire. You would have the option of choosing to invest in any combination of our plan vendors and be more involved in your own investment decisions. Both options require a monthly 6% pre-tax contribution from you, but the USG contributions differ per plan. USG currently contributes 19.98% to the TRS plan, and this amount can change each fiscal year. For the ORP plan, USG contributes 9.24%. More detailed information about your retirement plan choices, which includes a recorded video that you can watch on demand, can be found on the USG Benefits website in the New to USG section. If you want to set aside additional retirement savings, take a closer look at our supplemental retirement plans. We have 403B and 457B plans, which have pre and post-tax options available to all eligible employees in addition to your mandatory retirement election. These plans can be enrolled in any time during the year, and you can enroll in both if you choose to do so. You get to choose from our plan vendors, Corebridge, Fidelity, and TIAA. The annual employee contribution limit for 2023 is limited to the lesser of $22,500 or up to 100% of your compensation. If you're age 50 or over, you can set aside an additional $7,500. And please note that there are early withdrawal penalties associated with these plans. For your financial counseling and retirement resource needs, you can contact CAP Trust to assist you in making your retirement decisions, both mandatory and the voluntary plan decisions. This service is confidential and at no cost to you. Their financial advisors provide independent and dedicated advice to help you reach your retirement goals. Again, more information can be found on the USG Benefits website. Now that we're done with the mandatory elections and supplemental retirement, let's change gears a little bit to discuss the leave time available to you. Holidays. USG provides 13 paid holidays for employees. Now, each institution observes different holidays. Please see your institution's website to confirm the holidays observed by your campus. Vacation. Salaried employees who work 20 hours or more accrue vacation based on their years of service. Leave is prorated if you work less than 40 hours per week. For 1 to 5 years of employment, you'll accrue 10 hours per month, and it increases by the more years that you work. For 12-month faculty administrative officer on a fiscal year basis, you'll accrue 14 hours per month. Then there's sick leave. Faculty and staff accrue 8 hours of sick leave per calendar month. Now, we know our employees value their time off as it's part of your well-being. So take advantage of the time that's allotted to you. In addition to the federally mandated leave like family medical leave, known as FMLA, and military leave, the University System of Georgia also offers parental and educational support leave. Parental leave allows a parent to care for and bond with newborn, newly adopted, or newly placed foster child up to a maximum of 120 hours, which can be taken intermittently or all at once. Education support leave is to provide employees time off to promote education for up to 8 hours per calendar year. That sums up the USG benefits package overview. Now, are you ready to enroll? We've provided plan information, resources, websites, and the ability to ask questions, which we'll get to some more maybe in a couple of minutes if time permits. The next step is to enroll in your healthcare and voluntary benefits. Remember, you have 30 days from your date of hire or eligibility to complete your enrollment. 30 days. You may start the process by visiting the oneusgconnect.usg.edu website and click on Manage My Benefits to get to One USG Connect Benefits to enroll online. You can also enroll by calling the One USG Connect Benefits call center at 844-587-4236 Monday through Friday, 8 a.m. to 5 p.m. And then the last option is to enroll via a light mobile app on your phone, which is super easy. So you have 3 different ways to enroll. It's time to get started so you can beat those benefit enrollment deadlines. Enrolling in your mandatory retirement plan is slightly different for exempt or monthly paid employees. Remember, you have 60 days from your date of hire or eligibility to make your election. To get started, visit oneusgconnect.usg.edu. You'll select One USG Connect, log in, and then you'll select Benefits from the drop-down menu. Now, if you're non-exempt and you're paid bi-weekly, remember you're automatically enrolled in TRS, so you're not even going to see this option. Once you're on the retirement page, you'll select the ORP versus TRS mandatory tile to enroll. The Enroll in Your Retirement page will populate with information regarding both the TRS and the ORP. Choose the plan that you would like to enroll in by clicking the button associated with that plan. Acknowledge your enrollment in the TRS or the ORP by typing your full name in the box that's provided and then click Save. And you should receive an email confirmation of your election. Now, if you select the ORP, you must wait 24 to 48 hours to make your vendor and investment selections. Another reminder, once selected, this decision is irrevocable. You cannot change this election even if you're within your 60-day election window. So if you're not sure, you have questions, then cancel out before you enroll. Get more information from your HR benefits representative or the USG benefits website. The New to USG section has everything you need to know, including the instructions I just described. The New to USG section on the USG benefits website has everything. Excuse me, I'm repeating myself. I'm sorry about that, but I think you get it. Everything's on the USG benefits website. So what's next? Who do you call if you have questions after this orientation? Well, your first point of contact will be your campus HR benefits department for your personal data, direct deposit, access to systems. And then One USG Connect benefits for things like healthcare enrollment, certification, beneficiaries, or One USG Connect benefits navigation. And then remember, Cap Trust is your trusted no-cost advisor for retirement plans. So we may have a little bit more time, looks like. Do we have any questions out there?
Hi, Catherine. Yes, we have an active bunch in
Okay,
the
great.
chat and Q&A. So I have a few questions, some that I don't think may have been included here, but can I roll over a 401k from a previous employer into a 403b or 457b plan? And so this is a great question. And so, yes, there is a rollover option for our supplemental retirement savings plans. Actually, to initiate that, you would just simply need to contact the vendor, the retirement plan vendor you wish to invest with here at USG to initiate that process. So, great question there. Another one is, can non-exempt employees elect to contribute to a 403B, 457B plan? And yes, be it you're exempt or non-exempt, you are eligible to contribute to either of those plans, any combination. A question here is, when is open enrollment? When is open enrollment for our campuses? And typically open enrollment is in the latter part of the year. And typically we will send out communications around that time period as it's approaching, to alert and let all employees know that open enrollment is coming. Um, all right, and so there's another question here, is there a chart available to see the life insurance benefit costs? And yes, as Catherine has gone over with you all today, the USG benefits website will be your friend, will be your resource here as far as any benefit plan, enrollment type questions. And so that website is benefits, BENEFITS .usg.edu. So you can go there and navigate the website. You can look over healthcare. There's been some questions, more questions about in and out of network coverage, which plans are best for me, and how do I find providers in those plans and what have you. And so yes, if you visit that website, you'll be able to find all plan information, even dependent information. So Catherine also went over dependent enrollment and what those the mandatory documents are required for enrollment to confirm the eligibility. And so you'll find all that out there, life insurance rates, the comparison guide. So Catherine has also mentioned our 2023 comparison guide. It's like a 50 or 60 page booklet that includes all benefits and information to support those benefits, detailing those benefits in that comparison guide. And so there's an electronic copy out on the benefits website. So please visit the website for more information there. And I think that sums up most of the questions that are out here. There was one about vacation accrual. Are accrued hours available immediately, or do they start on a specific date? And so with vacation hours, those are accrued per pay period. So if you're paid on a bi-weekly basis or a monthly basis after each pay period, if you're checking your One USG Connect, if you're checking that website or looking at your pay stubs, you'll see how many vacation hours you accrue, or even in the timekeeping system or the vacation request system, time off system, you'll see how many hours you accrue each pay period, after each pay period. So and one last question here is, if I'm hourly, do I have to choose a retirement plan? And so the answer to that question is no. If you are non-exempt, meaning hourly paid, remember you are automatically enrolled in the Teachers Retirement System of Georgia. So no action is required on your behalf as far as your retirement plan election as an hourly paid or non-exempt employee. However, if you wanted to enroll in supplemental retirement savings plans such as 403B or 457B, you have that option, but you can enroll at any time during the year into those plans. So I think that kind of sums up these questions out here. But yes, we have had quite a few questions, and so just kind of summarizing them. I don't see any new questions here, but I think I've covered most everything that's out here, and it's been answered in the Q&A as well. Hold on, looks like one more just came in. It said it did, but I don't see it. Okay, I'm done, Catherine. Thank you.
Thank you so much, Benidra, for your and team for your support behind the scenes. Thank you, everyone, for joining. As we've mentioned a few times, benefits.usg.edu is your friend, as well as that comparison guide. Both of them are excellent resources, as well as your HR and benefits team at your campus. So don't hesitate to reach out. Thank you so much for attending, and welcome to the University System of Georgia family. think everyone's left. Looks like we had good participation in the meeting, so that was awesome. Thank you so much,